Hello, we're here with FSCDR, Warriors Within, and I'm here with Shantia, and we are here to talk about our wonderful Breaking the Silence story with sickle cell anemia. I'm just going to dive right in because honestly, we've been having great conversation, and I want you to just tell me everything and open up the platform for everybody to get an insight of what it's like with you because like we said, a lot of times we don't have that insight. So I'm gonna let you start off with give me a let's start off with the psychological impact. How does this really impact you from being a child to an adult as we are right now?
Okay, I want to take the time out to thank you for having me.
You're welcome.
And I would like to thank everyone.
Yes.
Since a child, I found out when I was 6 years old I had sickle cell trait. No one told me anything about the disease. I got sick when I was at home playing, and it felt like the wind was kicked out of me. No one knew what to do. No one knew who to call, what to say. So I was rushed down to Children's Hospital. I was put in an incubator, tubes up my nose, everything, trying to figure out. The doctor still could not tell me. And I can remember from that day wondering why me, what's wrong. Once they came back with the diagnosis, I went home. For years, I suffered. I was taking aspirin. I was taking Excedrin. I was called liars, make believe you're making out what your grandparents say when they have arthritis and things. So it started mentally breaking me down then, not knowing how to say something is wrong with me, but without wanting to feel different from all the other kids. So I learned to suppress what I was feeling. About time I got 13, I went to Jackson Memorial Center. They have a sickle cell center where you get tested, and they come back and tell you your full diagnosis. Once I found that out, I was devastated.
Okay.
Because we are told we won't live long. And I remember the commercials. I remember friends hearing about it, thinking if I tell someone, they're going to think I'm contagious.
Yeah, that they can get it too.
Hiding it from teachers, falling down the stairs because I don't want to take my medicine. I did not want to feel different. So the psychological part started as an adolescent, before I even became a woman, before I became a mother, a wife. I had to fight in silence.
So let me ask you this. Did you have, as a child, how hard was it to express, hey, I don't feel okay. This is something that's wrong with me. To express to an adult. Let's start with that. Because sometimes as a child, even in school, I feel like that's hard to express.
It is hard to express because we come from a culture of where we're supposed to be seen and not heard. We come from a culture of staying in a child's place. So a child running up and just saying, I don't want to do the dishes because my back is hurting can come off as disrespect.
Very so.
So we don't know where to speak. We don't know when to speak. And then when we do have places like the Sickle Cell Foundations and certain doctors like Dr. Blight and Dr. Harrington, Dr. Pagolo, we find our voice. We come into our calling, and we're learning through the pediatric rooms and the pediatric scenes and friends and family. This is your safe space. So when you get into the pediatric floors, you get to say, I'm hurting. You start using your voice because at home you can't describe what you're feeling.
Yeah.
For years I was told, what am I feeling? And I could never explain it. And now I finally got it. It's like walking in a cave and all the icicles falling on you at one time while your hand is being slammed into a car door.
Ooh.
So it's the throbbing and the stabbing at one time. As a 37-year-old woman, I can explain that, but as a 7-year-old child, I couldn't.
Yeah, because I can only imagine. As we discussed, I have a son, and he's sickle cell anemic, and he explained the pain very similar to that. And as an adult, it is hard to, I guess, try to understand mentally why can you not, you know what I'm saying? Because you grow up just thinking God gave me this body, I can get up and I can move my 10 fingers, 10 toes every day. So I can only imagine as a child when you're sitting there and you can't really move your 10 fingers and your 10 toes the way everybody else is. So then let's kind of fast forward. transcending into middle school, high school, where kids are getting active. There's getting parties and things that you can't participate in.
That is even harder. I'm going to explain something to you. We had a Disney World trip set. My mom, my sisters, and brothers. But because it was going to be a lot of walking, as a teen, they voted to leave me home. Because taking me was a liability.
Yeah.
So I found other ways to cope with it. It wasn't always healthy ways, but because I felt alone, I found other alternative ways to find an outlet. When you get to middle school, that's when the peer pressure really starts. You start to want to be a part of something. In middle school, you want to be a part of a gang, a tribe, or something because you know where you belong. But a lot of times, once the kids find out you are the minority of the group, you become the eyesore of the group. You become the person that they look to be the scapegoat. So you find yourself always overcompensating for everything you do. You want to make sure you're the most prettiest. You want to make sure you're the smartest. You want to make sure you're on time. You're always a friend. I found myself being too much to everyone.
Yeah.
My coping mechanism was always being the mom, always being a friend that's available because I didn't want to die alone. I can literally sit in this chair and say a part of me became a mother and a wife because I didn't want to die alone.
Yeah, I can understand that.
So we are thinking about death in middle school.
Yeah, the early age.
We're thinking about death in high school. We're not thinking about prom because society done told me I won't make it to prom.
Yeah.
So why should I even get up and care about life when you already gave me a date on my life?
A time span. So you automatically grow up expecting to just put a time span on your life. I have to live it out for this time period, and that's how I'm going to make the best of it.
So you really don't prepare for college because college seems so far away. You prepare for the rain. You prepare for the weather. You prepare for tomorrow. You prepare for the youth fair. Something as the youth fair became a burden to me because my friends want to walk the whole fair. They want to go on all the rides. They want to do all these things that I can't do. So now I'm the friend holding the bags, holding the extra food, holding everything, watching the world around me go by and wondering what's wrong with me. When will my doctors give me a cure? You know, to watch infomercials. We see infomercials of everything, but wonder why my disease is not on infomercial, mommy. You know, why they don't have foundations for me. You know, why can't I speak my truth? And once again, it's to be seen and not heard. It goes back to that scenery. Even in a doctor's office, you come, you're being seen, but don't be heard.
So in school, did you attend, what kind of school did you attend?
I attended school. I went to Miami Northwestern High School. That was a challenge.
Okay.
I'm going to be honest why. My principal had to sit me down and say, baby, I'm kicking you out of school. Not because you are a bad student. He went Northwestern, Gallon. He talked to me, Dr. Gallon. He said, not because you're a bad student, because if I don't kick you out of school, that's the only way I can get you help. That's the only way I'm going to get you into homeschool, because you're too sick to stay here. I had to be kicked out of Miami-Dade County School. Not because I didn't do my homework, not because I didn't make the grades, because of my health.
Because of your health.
Because another doctor didn't feel sickle cell was a disability.
Okay. So with going forward, do you feel like school, uphold, and family, they all tie in together psychologically with weighing down on top of having sickle cell?
Okay, I'm going to explain it. I'm going to separate the two. When you're in school and you're sick, friends are more or less off. They want to come to the hospital. They want to hang out. We have fun. Now, one thing I can say as an adolescent, Central 6 Jackson, we turned that into our own little sickle cell club.
Oh, yeah, you have to. You on the floor all
we started spray painting our wheelchairs, gold rims. We did everything. But when you become an adult, people get tired of you being sick.
Yes.
You'll become a burden because life goes on. We're no longer kids looking to play after school. And it hurts because you'll watch families show up to someone who broke their leg. The whole family's at the hospital, balloons, flowers, and everything. But you're in ICU. And guess what you get? Oh, you sick again? All right, you're going to be okay. You strong, you'll make it, but no one shows. So that's when we start to isolate ourselves, and that's when the mental health really kicks in. Because now I have to deal with mental health that I've been struggling with all my life. Now I have to deal with the medication with the mental health. That is a whole different stagnant. And to be left in a room all night long with my own demons. And all I could sit in this room and think about, am I going to die tonight? Is today going to be the day that I'm gone? So you start to find ways not to get into the hospital. You start lying. You start taking too much of your medication or not enough of your medication. You start going around and putting on a face that's not even you. That by the time you wake up into your adulthood, you don't even know who you are. You know what you are, but you don't know who you are. And that has a lot to do with being prescribed medications, but no one's sitting down and asking me how I feel. And I'm not just talking about medication as for the narcotics part. I'm speaking of medications for everything. Because one medication doesn't fit all. So some of us are having a hard time even wanting to get up and take my meds. Because if I get up and take my meds, I may miss out on going to do everything else today because my medicine may make me sleepy. And I can't keep calling my hairdresser and saying, oh, I'm sorry, I fell asleep.
Or I got to reschedule because I'm in pain right now.
So now I can't go to my friend's engagement party. You know, everyone is going on a trip to Jamaica. Or they wanted to go to Aspen. It was an Aspen trip. I couldn't go. Because they didn't have a sickle cell unit. They didn't have a hematologist that was known for sickle cell. So how can I go to Aspen? How can I even go out of the country for more than a month? Because I have to be back for my prescriptions. I cannot live a normal life even if I want to. And you have to get to that point that you accept it. That is going to be the biggest strain on your mental health if you don't accept who you are and what you are.
So where do you feel like, as a child, that it could have been implemented more help as a child all the way up to adult? Could there have been more advocates, mental health advocates? Because, you know, in school, like we talked about before, they have advocates for all types of clubs, for everything.
But not for sick kids.
I've noticed that very much so. So where do you feel like they could implement? What kind of advocates?
I think it's called our 504 plan for school. And our IP plans. I think when you do the 504 plans for school, it should come with a mental health.
Agreed.
Because I even give my kids mental health days off of school. School can be controlling. School can be heavy. School can be a lot of work on one child. So when they put together our portfolios, that should be a part of it. To understand, look for the signs, not just for pain, look for the withdrawal. Look for the quietness. Look for spots. Look for other things that's going on just besides me crying out for pain. Because sometimes me being silent is saying I'm in pain. Sometimes me not coming around for a long time is stating that something is wrong. And how could I say something is wrong when I don't even know what I'm facing? I know I'm feeling it, but I don't know diagnostic-wise what it is. So growing up, I think from pediatrics until we leave this world, sickle cell needs a mental health advocate. We need someone to show us how to properly deal with our pain, our heartbreaks, our loss, and everything so that we can medicate ourselves properly, but also understand when we don't need the medicine because it is a slippery slope. For me, I was born a crack-addicted baby. So I am more prone to addiction than other people. So I have to be very careful on what I do and how I do it. So I'm not able to just keep switching medications because I have a more active proneness to it because I was born with it already. That is something we don't talk about. We don't talk about our parents being in control of us, but our parents can have habits too. You're sending me home with narcotics, and I'm living with an addicted parent. And you asking me why I'm in pain. I have not had my medicine in the last 3 months because my mom took it all. But I can't tell you my mom took all my medicine because that's the only person that got to take me to the hospital. So how do I go to my doctor and say, I'm constantly in a crisis because I don't have my pain medicine? Mommy took it, or daddy took it, or grandma took it.
Yeah.
And if you tell on them, we come from a culture you don't tell.
And you get in
So
trouble.
imagine how long I suffered.
Yeah.
You know, that has been people's story.
Mm-hmm.
You know, also worrying about where I'm gonna live. You get Social Security. That's a lot of money when you go try to get government assistance. They won't give you assistance. I'm looking for a home right now. I've been out of a home for 2 years, and it's hard because I need a place that's close to my facility. I cannot live far, and this is the only sickle cell clinic that has my medications. That has been a mental strain.
Yeah.
It has been a physical strain on me. Trying to go to the dentist, it's a hard battle because you have dentists that look you in your face and tell you you're a sickle cell patient, I cannot take you.
Agreed.
And you want to say, you have a cancer patient, you have an HIV patient, what's wrong with me?
Yeah. What makes you different?
But we need so much that people don't even want to take the time out to treat us. We have had hip specialists, I can't remember their name right now.
Yeah, I know what you mean.
Turn us away because they cannot deal with the sickle cell. That is all a mental strain.
Yeah.
Miami is perfect for a sickle cell patient, but living here financially is not.
It's not.
If I'm getting $800 a month and the one bedroom go for $1,600,
You barely making it, baby.
let's talk about the credit, the mental stress of my credit. I have to say, do I want A1 credit or do I want to go to the emergency room today?
Because you got hospital bills out
I have more bad credit from hospital bills than my own actual doing. So I'm being punished for something I can't even control. So it's days I don't want to go to the ER because I don't want more on my credit.
Yeah.
How do I build myself? How do I become the loving and productive adult that you're telling me to become when there's nothing in place to help me?
And then let's not factor in the love life aspect either, because everybody wants to be loved.
Everybody.
That we come into this world, we get loved by our mom, our dad, and we want to eventually grow up and be loved. So that has to be another physical, like you said, that's a heartbreak in itself.
It's heartbreaking because if you find someone that has the trait and you have sickle cell, we have two options. I can love you, but we cannot have kids.
Yep.
Or I can love you and allow you to live your life. That's the only two things I can do.
Yeah.
I can love you, but I will never be able to be a mother. I will never be able to hold my own child. I would never be able to understand how it is to go to their graduation or prom or weddings. I have 2 kids. And I can imagine if they would have came out with sickle cell.
Yes, I totally agree.
So going out and dating, you have 2 questions. Have you been tested for any, STDs and things? Also, have you been tested for sickle cell trait?
And I can only imagine. They're probably like, what?
That's what you're going to get.
What? Like,
what
are you talking about?
What you're trying to say?
Yeah,
what
you
I
trying
have.
to say?
And
I don't have nothing. But that's not the point.
And then now you done took the date away, and now I'm sitting on this date educating you about my sickle cell.
Yep.
And now you see me as a medical burden. And now the woman you seen walking past in this beautiful dress an hour ago, the focus has flew away, and now you diagnose me as a patient. You know how hard it is to be out, and every 4 hours you have to take your medication, and you have family members while you're at a retreat or you're at a reunion, and they're like, "Oh, girl, you taking another oxycodone?"
Yeah, because they don't understand.
They don't understand. Or you don't think that's too much medicine? Oh, she addicted, child. I've been here 4 hours, and in the last 4 hours, she done took 2 pills.
Yeah.
And
they don't understand the
They don't
balance
understand.
to
So imagine having to go to the car and hide and take your pain medication. Imagine being on a date and you're going to crisis and you're in the bathroom.
Yes.
And you're taking your medicine and you're calling your friends like, girl, I'm in crisis and I need a ride to the hospital, but I like this guy.
And you too embarrassed to try to break it down to him. So I can totally understand that.
So we're going to go a little bit deeper. Intimacy. You have to take your meds sometimes before intimacy. Imagine you're stopping like, yo, we're here, but I need to go take all this medication because it's a chance doing all of this can send me into a crisis. No one talks about that.
Yeah, because you're not talking about, like I said, we're being transparent here. We're not talking about the flipping, the motion, and everything.
men directions that they have their problems with sickle cell. They're swollen for days. As a woman, can you understand this is not something he's trying to do? This is a effect of his health. You know, that is a big factor. You know, who wants their kid to be married to the sick kid?
Yeah.
And in some cultures, it's taboo. You don't do that. So she can't give you kids, or he can't give you a son. I mean, a child. You can't marry them because their leniency depends on this.
Yeah.
It's a lot of things.
Yeah.
You know, also being dependent on your parents longer than a normal child. Where a normal child is like 18, I'm gone. And at 18, you're worrying about college. You're worrying about your love life. At 18, I'm trying to transition from pediatric to adult.
To the adulthood.
And pediatrics and adulthood is different. In pediatric, you're seen as a patient. You're seen as, like, you need help. When you become an adult, you become an addict quick because the medicine, it goes up.
It goes up.
And you will be questioning yourself, like, Miss A just babied me and brought me my Jell-O, my ice cream, my warm blankets, and I get over here and I'm pushing the button and like, my heart, I'm sweating, something's wrong. And you'll hear them talking, saying, oh, they just want their pain medication. They begging for their medicine again. You know what they do mentally? If you're in the room and you hear it over the comm and they think you don't hear them discussing your pain medication, oh, every 4 hours they're hitting the button to turn on that light. That right there sets a tone in your head that, you know what, I'm going home and I'll medicate myself. So you start becoming a doctor. You start playing with time. Okay, they say I got to take it every 4 hours. I'm going to take it every 3 hours because it's going to kick in 4 hours. You become a chemist in a way. And then you become the family doctor, because I'm the family doctor. Everyone swear I know everything that's going to happen with the medicine.
I agree. I became a doctor, and I never went to school a day in my life, but I promise you I can administer oxymorphine and everything
you
by
become
the hour.
The family medical spokesperson, and you're finding yourself doing a job that you never wanted to do. I never wanted to do this job. I know I always wanted to do ministry and baking, but God seen something else fit for me. So I have to do this job at Sickle Cell. Yes. This job is not given to the weak. To be a Sickle Cell warrior, you have to be one of the strongest people around. I did 17 withdrawal of dental up with local anesthesia. And my mom was like, if it was her, she would have been done. I walked out of that room like, listen, I got to get to school. My baby got a basketball game. I got to go. I was back doing everything. I didn't have time to rest because I'm still a mom. Yeah. Where someone else would take it and be like, I need to Christmas to get out of this. No, we don't have that time. Yes. I have to get this done because your tomorrow and my tomorrow is different.
Of course. So let me ask you this. In this aspect, what do you think, as in when we say psychological impact on not just that, how has it impacted you with your kids? Well, being a mom.
Okay. Being a mom, it impacted me a lot. I had my first baby at 17. Well, I had her at 18. I got pregnant at 17. I was told due to sickle cell, she can come out with Down syndrome, underweight, withdrawal due to the pain medications. Everything went well. However, I started to see signs of a child who had narcotics in their system as they were being born, temper tantrums. She started acting up. Every time I would go into the hospital, she would fight. She would give people hard times, Baker acting. And I thought it was something wrong with her. I did never put it back to she just wanted her mom to be normal. And how the kids made her feel at school knowing her mom is sick. Because some days I'm walking like an older lady. You know, some days they want to go to the park. I can't go to the park because it's too cold. It's about to rain. It's too hot. She went through a lot. And imagine it's graduation time and your mom is in the hospital. You know, it's prom time and your mom is in the hospital. For me, it was my wedding, and I had my bridal shower at the hospital. Oh, wow. I couldn't get home. Oh, wow. That took me years to get over, because the biggest day of my life got overseen because of
Yeah.
sickle cell.
'Cause of
I
sickle.
couldn't even have a regular wedding because we didn't know if I would be okay for my wedding day. Imagine spending $80,000, whatever you spend, and it's your wedding day, and just because you're overexcited, sickle cell kick in. See, no one talks about when you're overexcited how sickle cell
Yeah.
kicks in too. So we even have to
Agreed.
be careful with being too excited for things, and it's a mental strain on my marriage because my husband is like he's scared to surprise me
Yeah.
because he don't know how I'm gonna feel. So a lot of things is really calculated on what we do and how we do it. And I never thought about how it made him feel.
Yeah.
You know, it's a burden on him. He can't just have a normal wife and just say, we're going to jump in the water, pull the car over, and just jump in the beach. No. It's like, babe, do you have your warming pad? Do you have your medication? He has became a caregiver.
That's beautiful.
But he never signed up at first
Yeah.
for that. You just go along with it. He
Yeah.
never thought he'll be a caregiver. And it's beautiful because he had a cousin that passed away from this illness. And him not knowing God was preparing him through this cousin for his wife.
Yeah, no, that's deep right there. That is deep.
So marriage is not always, it's not easy. And, you know, I put up with a lot because I know he puts up with a lot.
Yeah, of course, because like you said, constantly in and out the hospital.
Mood
That's
swings.
alone. I can only imagine how he feels as a husband because as a mother, I struggle watching my baby, my baby go through that. I want you to dive into a personal story for me and let me know about something that it sticks to your heart about what happened to you as an adolescent that can give these viewers what it's like to actually insight. Let me know. Let me feel what it's like to be in your shoes when this happened to you, when you were an adult in the hospital, because we don't hear these stories. Because I can only tell you pediatric stories, and my pediatric stories sound just like everything you're going to tell, you know, everything of your childhood. My son gets treated great, and I hear it all the time, so I try to prepare him for situations like what you tell me.
Okay. I can remember recently I was admitted, and upon admission, they found out I had pneumonia in my lungs. I had a blood infection, and I was in a sickle cell crisis. The doctor felt what my doctor's prescribing me is too much. We don't need that much. I had, and not even had, my husband slept on the floor inside my room because he refused to leave me. We had to go above the doctor's head and call in the chief of medicine. And I had to call in help. The only reason I got the help in my medication, they would not reach out to Dr. Blyden. The reason I got it is because Dr. Blyden, two of my nurses, he was one of the nurses saving grace when her father had cancer. And the other nurse, 30 years ago, he brought her in and taught her how to be a nurse. And they felt indebted to him. That's how I got the medication. They went over the doctor's head, called Dr. Blyden and said, you have a patient here who is in trouble. Then they went over and got the chief of medicine. The chief of medicine told my husband to get off that dirty floor. He's been sleeping down there for 2 weeks. He made a pallet on the floor because he was afraid if he left that hospital room, I was going to die. He finally got a bed next to me like a human. A human. Imagine being lured to a dog. Yeah. And you have to sit as a dog, as a black man in this world. That's the only way your wife going to get help. Yeah. And to be told that a blood infection, pneumonia in her lungs, she shouldn't be in that much pain.
Ridiculous.
At the height of COVID.
Ooh.
I stayed in there for almost a month fighting for my life and had to walk out without a place to live to a hotel room because I couldn't go home to my family because they had COVID. Where was the preparations for days like this? I lived in a hotel room paying $150 a night because no one could give me help. I've been crying out for help for 2 years. No one came, not the hospital, nobody. I have been the helper. We are tired. Yeah. It is beyond the hospital now. it is getting to a point where I want to know, when do I start becoming a price tag?
Agreed.
Because you're coming here for your check. I'm coming here for my life. We are not the same. Mm-hmm. When you walk away here knowing you're going to be fed, okay. I walk away from here knowing I got a debt and I don't know where I'm going to lay. I cannot live in certain places because I have this illness. I have to be close to certain hospitals. Yeah. I have a daughter with an illness. I have a daughter that suffers from mental health and medical illness, minimum change disease. So I have to be close to her hospital team too. And unfortunately, the hospital's always in the communities where my kind don't live. Yeah.
So how does family support play a big part in it for you?
Family support plays a big part of the medical and the mental. Okay. Because if you have family support, you are most likely to live a little bit longer. Mm-hmm. I have seen it with sickle cell patients. Okay. Because you have something to look forward to. You have something, your niece is going to graduate. You know, your nephew is going to grow up. You may have an auntie or grandma that's praying for you. You find something to latch onto, because in our culture, family is the root to everything. Yeah. Sometimes going to grandma's house and getting soup is better than the medicine. Yep. Sometimes grandma rubbing alcohol on your knees because she only know that way is better than that. Agreed. Sometimes her telling you this aloe may be nasty, but I'm finna rub it all across your mouth and your face is going to help. Then you sticking me in my arm. Yeah. So family is the root to keeping us going. Family is the root to making sure we're living. You know, my mom has to wake up now, and she does it a lot. She rubs the bottom of my feet because sometimes I'm sleeping so still. She's afraid I'm gone. Yeah. My kids get up in the middle of the night when they know I constantly be sick. Imagine a child, you have school in the morning, and you keep walking to see, because daddy's at work, is mommy still breathing? Mm-hmm. Imagine calling your school and telling your child, baby, I went to treatment, but I got to go to the hospital. Mama don't know when she's coming back. Mm-hmm. But mama, I got the prom. Baby, I don't know if you're going to make it to prom. Yeah. It can make your kids rebellious. Mm-hmm. So family is the only thing you have to hold you together. Without my mom and her wife and my husband, I cannot say I would be the woman I am sitting before you. I could sit here, but I would not have the mind that I have. I would not have the love that I have. So without my family, it is no me. We are a team. Yeah. We may not get along every day, and I get tired of answering the phone from my husband.
I can only imagine.
It's like, did you take your medicine? Did you do this? Yeah. Did you do that? Did you go to treatment? It's annoying to you. And some days he's annoyed by treatment. Oh, you got treatment again? But he knows it's either treatment or the hospital. Yeah. And I have to even say, okay, baby, I understand. You're frustrated. You're not frustrated because I'm sick. You're frustrated because you prefer me to be home. Yeah. So family is the link to this whole plan.
What has been your coping mechanism? Because I notice I'm every sickle cell patient or sickler, I don't even call them patient. I call them my little warriors, because they are sickle warriors to the fullest. They all have a coping mechanism.
Well, to most people, they call me mommy. I'm a mother by nature.
I already get that.
I do motherly. I don't know why. I just do it. Since I was a child, I have taken care of kids since I was 6 years old. So for me, it's going to be my ministry, my business. I want to one day own a shelter for women who have been sexually abused. It's called a Cupcake of Faith, because women are like cupcakes. We're sour, sweet. You mix it all together, you get the best cake. You know, I want to have a food pantry for people who are disabled, people who are needing help, you know, not somewhere where you just throw old stuff in a box. I want a store where you can come and you can shop with dignity, and you don't have to feel like I'm trash, like someone is just giving me secondhand goods. And that's the reason for the shelter, so the girls don't have to dance, they don't have to strip, they don't have to sell their bodies. They have a place to come home, because a lot of people are there because they don't have no family. Yeah. So I want to be their family. Yeah. I want to have a ministry with my business partner, Patricia. We're going to do Ghetto Girls Ministry. It's going to be a ministry where women can just be themselves. You know, we may not have on a tabernacle hat, and our dresses may be still a little short and tight, but we're going to have somewhere we belong. So that is what's keeping me going.
Okay. I love that. I love the name. I love the ambience and the go for it. Because you have to have something you have to have a community. Yeah. you have to have something to keep you, like you said, motivated and going. So that's why I asked, what was your coping mechanism?
My shelter. My shelter is, anybody will tell you, when you see me at treatment, I'm writing all day long. Like I'm writing. Because I have to get this done. You'll see me praying and writing because for years I wore a mask. I wore a mask, I think for like 10 to 12 years I wore a mask. I was the loud girl, the girl that, let's get crunk, let's do this, let's go to this, because I wanted to be a part.
Yeah.
And it's not because that who I was, it was because that what got me to be a part of it.
Yeah.
So I'm going to always make sure I was out doing it. I had the best fly boyfriend and everything, and I woke up one day.
And I also feel like, to chime in, that goes into where we stay at, too. Because we stay in Miami. Yeah. And granted, this is a great area, like I said, for someone with sickle cell to live, because they talk about the climate and everything else. But I can only imagine, because I'm from up north, and up north with a sickle cell, we bundle up. It's no going out, and how the lifestyle is here.
It's different. We're
different.
Outside.
You're outside. So I can only imagine, again, having a condition like this. Everybody's outside, but I'm inside.
All my friends have on their bikini. Yes. They're going to the beach, and I'm sitting there under the shade, covered up, and I suffered for years because I went against the grain. I'm drinking, I'm partying, I'm having fun, and no one sat me down and say, baby, you're shortening your life.
Your life.
I know it's fun, and I know you're seen, and I know everybody know you're popular, but you're shortening your life, sister. I had to wake up, and I had an encounter with God, and when I woke up, it was like, okay, this is what you're going to do. You are meant for this. The shelter is yours. Sit down, get this work done, because you have women behind you and in front of you, depending on you. So when I started realizing that this walk of life was bigger than me, I was here just to leave my footprints, and I made a deal. I'm going to leave them in the sand and in the snow.
Yes.
So I'm going down and up.
Yes, I agree.
So that's what's holding me on.
I love it, because you have to, like I said, you have to make it known. Because if you would have had somebody sit down and tell you that ahead of time, you would have definitely moved a lot differently.
If I would have had a mentor in sickle cell, if I would have had an older woman or a young girl, imagine if you can get 3 girls right now, 12, 13, and 14, which you can tell them about sickle cell in life. And not even just giving up your body so fast because you want to be accepted because you're a sick girl.
Yeah.
So you have to also understand, do men play on you because you're the sick girl?
Yep.
I have been introduced to people just because they know the medication I take.
That's deep. And they don't talk about that part.
Wondering, is the partner you're sleeping with addicted to pills, and they're going to take your medication?
Yeah, that's serious.
Waking up in your pills, the bottle looks kind of short.
And what's crazy is you need it. They don't. And that's the hurt, because that's when you start to realize you can't really trust nobody.
But when you want love so bad and you want to be accepted so bad, you are willing to take the first man that shows you some type of love. We need women to say, hold on, baby, I know a different way. Let me show you something else.
Agreed.
This is not the only way of love, and we're trying to find someone to take care of us too.
Yeah.
Honestly, I'm tired. My family's tired. So society said if I partner up with a partner, he's going to be the provider, he's going to be the protector, he's going to be all of these. But society don't prepare us for the wolves in sheep clothing.
That part. And we're back with my girl Shantia. Listen, I'm loving our conversation right now. You are amazing. Let's start with that. I'm loving how transparent you're giving me. I'm loving the authenticity that you're giving me, because it's hard to give that sometimes when
you're under a microscope.
Yes, exactly. So I really want to dive in. This is my last big question for you. Where do you see the hope for sickle cell?
Okay, I'll start with the work Dr. Blyden and Dr. Bronte is doing with the community centers, opening up a recreation center, so we'll have somewhere to go to in the daytimes when you're not going to the doctor. You just may need somewhere to get your paperwork done, somewhere to belong, somewhere you want to play ball with people who are like you. to know that it's other centers being open throughout the state of Florida so we can travel, to know it's other centers being open inside United States, period. That sickle cell is on the docket. Mm-hmm. We have new experimental
FDA approved
drugs, experimental drugs approved. We have more outlook. It's more or less now the mental state of it.
Yeah.
To have doctors that come in and say, okay, we're going to put a mental health package together for you guys, personal to you, because your mental state and this person's mental state is not the same.
Agreed.
A requirement through the state and through advocacy to check in every 6 months, just to say I'm okay, this is where my mind is at, this is the state of my realistic world. 6 months ago I was on top of the world, but right now I feel like I woke up and the world is on top of me. Or I was under the world 6 months ago and now I'm on top of the world. Having a mental health doctor to check in with from time to time would be a great thing for the sickle cell community.
Agreed. I totally agree. And I'm more ecstatic about, like you said, with more of the centers being all over the place at this point. Because not only can you don't have to stay in one spot. I believe, like you said, a lot of kids that have sickle cell, they get homeschooled, and then you're stuck in one place. I homeschool my kid right now.
I was homeschooled.
Exactly. I homeschool my kid, and I make it very imperative that I travel with him. And I want him to know that the world is not limited to him in just one spot.
Not to cut you off, so imagine this. One Disney World. What if you say, Mommy, I want to go to Disney World in Cali.
California. Exactly.
Mommy, why can't I go skiing? What if he doesn't like the water? He likes the snow. You'll know, like, okay, we're going skiing, but it's a center in Denver.
And
it's a center in New York.
Yes.
It's a center in Wyoming. It's a center in Wisconsin.
Yes.
It is a center. It is a place because it's people in Wisconsin with sickle cell.
Yep.
I didn't even know Alaska has a hematology oncology.
Really?
I researched it because I want to go see the Northern Lights.
Okay.
So I've been preparing when I go, and that's something. Why can't I just go see the Northern Lights like a normal person?
Just get up and book the plane ticket and go.
I have to make sure I have a whole team ready just to do a bucket list.
Yeah.
So I've been preparing myself for Alaska one day to see the Northern Lights. So that is something I'm preparing for in my future. To make goals, to set goals. If they tell you you're not going to live to 23, make you a 30-year goal.
Yeah.
They told me I had 18. They told me I had 25. They told me I had 30. Now I'm going on 38. My daughter's going to be 20 years old. I wasn't supposed to live past her life.
50 and 30, 40
more, baby. Yes, and I cannot wait, and I'm just planning for that day. I'm making sure all my sickle cell patients know you could be a mom, you could be a husband, you can be a business owner, and I'm learning that. Yes. For so long, I thought sickle cell was the only thing I had, and I have woken up and understand sickle cell is just my introduction into the world.
Exactly.
And this is my introduction to say I am here, I am healthy, I am living, and I am planning to beat this disease. And if I can't beat it, I'm going to leave enough behind that everyone behind me have the blueprint on how to run sickle cell.
Yes, I totally agree. I like to sit there and say to all my, like I said, to my sickle cell warriors, sickle cell doesn't have you. You have it. Honestly, everyone I find and I encounter with sickle cell, you guys are strong, resilient, powerful, motivating. That's what says you can beat everything.
So I tell people, don't tell me to buck up and take the ride. Tell sickle cell to buck up and take the ride. Because sickle cell is getting ready to take a whole ride with me. And it's going to be a lot. But I got a heating pad. I have my team. I have my business partner, Patricia. And we're ready. We're like, heating pad,
and baby, you got this chair right here, and
we're ready to go.
The Sickle Cell Foundation, and we're ready with you.
The sickle cell has a lot to go. We have a lot of groundbreaking things to do. So if you are a sickle cell warrior, please do not think this is your stopping part. This is not where you get off the train. And if you get off the train, you get you a ticket, you click it, and you get back on the train.
I love that.
Sometimes we have to get off. You have to know, okay, this is not where I need to be. I need to get off, take care of me. And when you do it, you can get off.
Agreed.
Yes.
So I want to tell you, I appreciate you for coming. I appreciate you for being here, and I appreciate you for dropping knowledge and beautiful gems and just being a positive light.
Thank you for having me.
I appreciate it. And you definitely have to come back again. And I appreciate you for being on our FSCDR Warriors Time.
Thank you so much.
Thank you.
I want everyone to keep the faith, understand God is not done with us. He has a plan, and if he gave you this disease, it's a part of his plan. And you have to work it until you cannot work it no more. Do not allow a doctor, do not allow a family member or a heartbreak to stop you.
Agreed. I appreciate it. Thank you
so much.